Hello, everyone. Welcome. Come on in, find a seat, get comfortable. We'll start here very shortly. Okay, it is the top of the hour, so let's just jump right in. Hello, welcome. My name is Alan Barr with COEH Northern California. And on behalf of the NIOSH-supported education and research centers throughout the country, we're pleased to present the 2023 ERC Ergonomics webinar series, where we offer free monthly webinars on various topics on human factors and ergonomics. This collaborative effort on behalf of each ERC's continuing education program aspires to provide access to current research supported through NIOSH ERC programs. Thank you for joining us today. If you logged in with your registration email, you will receive a link to an evaluation form that will qualify you for a certificate of completion worth 1 continuing education contact hour. Upcoming webinars, we have next week on the 24th, California Labor Lab webinar, Supporting Healthy Work, Law and Regulation. Our next ergonomics webinar on the 21st, I believe, is aspects of backpack vacuum use, evaluation of carriage location and sweeping technique. And that's on June 21st. You can register for those webinars and others by visiting coeh.berkeley.edu/webinars. For today's webinar, you will be muted during the presentation, and if you'd like to ask a question, and we encourage you to do so, please enter it into the online Q&A, and we'll save some time at the end of the presentation for Melissa to address your questions. Today's webinar is being recorded and will be made available along with past webinars on the COEH Northern California YouTube channel. Please take a moment to like and subscribe to our channel and help us continue to grow. Today's webinar, the impact of precarious work and psychosocial stress on physical and mental health of California janitors. Today's presenter is Melissa Afterman. Melissa is a board-certified professional ergonomist with over 20 years of consulting practice in industrial, laboratory, and office ergonomics. She's a consultant, researcher, and instructor with the University of California Ergonomics Research Lab and Graduate Training Program, and an instructor in the COEH Online Ergonomics Certificate Program. Melissa earned her master's degree in Human Factors Ergonomics Engineering at San Jose State and her undergraduate degree in Agricultural Engineering from Cal Poly State in San Luis Obispo. I'm very pleased to have one of our very own being the presenter today. So with that, I'll hand the mic over to you, Melissa.
Great, thank you so much, Alan, and good day to you all. I'm looking forward to sharing with you a part of the work that we've been doing on the California Janitor Workload Study. Let's get right on into it here. Before we begin, though, I will just a couple of quick disclosures. This project is supported by the NIOSH Training Grant and also the California Commission on Health and Safety and Workers' Compensation, the Service Employees International Union, and the Maintenance Cooperation Trust Fund. And our research at the UC Ergonomics Lab is supported by the companies and organizations that you see here. Let's talk about janitors. Janitors, or if you want to call them custodians or housekeepers, they're essential workers that are employed as caretakers of the public spaces that we utilize every day. They perform physically demanding work that requires lifting, forward bending, moving heavy equipment, and prolonged standing, which can result in low back pain and other musculoskeletal disorders. Compared to other occupations, janitors report poorer general health and higher rates of depression, and they report work organization factors that can increase the risk of injury or illness. It's estimated that 2.3 million janitors are working in the United States at this point, with over 200,000 of those employed in California alone. Janitors rank third for injuries and illnesses with lost work days, with over 21,000 cases reported in the year 2020, with an incidence rate of 191.6 per 100,000 workers. And in 2015, the lost workday injury rates were almost 3 times higher for janitors than for all other occupations combined. In a really nice resource document put together by the UCLA Labor Center and MCTF, came out last year. It's a profile of janitorial workers in California, and I'd like to share with you some of the data that they presented. They found that 83% of janitors are non-white. The 70% are Latinx. 37% are subcontractors, and 62% are low-wage earners, with a median wage of $13.51 per hour, which is compared to a median wage for all workers in private sector in California of $19.32 per hour. And those median wages are lower for part-time workers than for full-time workers. So you see the breakdown here, $11.47 for part-time janitors and full-time at $14.06. Showing that also 49% of part-time janitors are living below the poverty line, and 36% of full-time are. When we look at comparisons between the female workforce and the male workforce in this report, we see that there are more females working in part-time arrangements, subcontract arrangements, or independent contractor arrangements, with a lower median wage than those of their male counterparts, and a higher percentage living below the poverty line. In terms of nativity of California janitors, higher percentages, no matter what the work arrangement is, their higher percentage are foreign born than as compared to all private sector workers. So 37% of all private sector workers are foreign born compared to the percentages that you see on the left of that line there for janitors. And this related to this is the English proficiency, with similar trends where 90% of all private sector workers are English proficient, and lower percentages, no matter the work arrangement, for California janitors are proficient in English. And this profile of janitorial workers in California from UCLA is a really nice segue into talking about precarious work. Precarious work is a type of work which is poorly paid, unprotected, and insecure. Often we see work arrangements that are part-time, subcontract in nature, or independent contractor type arrangements, which disqualify workers from wage and discrimination laws and employer insurance and benefits. And usually low wages come along with this. The UCLA Labor Center profile really illustrates the precariousness of the California janitorial industry. Research has shown connections between precarious work and health. For example, job insecurity has been related to the risk or presence of depression, anxiety, and emotional exhaustion, as well as to general low satisfaction with life. And work precariousness was associated with job stress, poor physical health and mental health, and more days with activity limitations due to health problems. So it's pretty clear that the impact of precarious work has impact on health in general, but the impact of that on the health and the physical and mental health of janitors in California is maybe not as well documented. And so we'll take one step to the side here and now talk about work psychosocial stress. So psychosocial stress is a perceived threat to our social status, our social esteem or respect, and or our acceptance within a group. It's a threat to our self-worth, or a threat that we feel we have no control over. In the workplace, we often refer to this as job strain. And some common assessment tools that you may be familiar with or heard of are the job strain or ISO strain model, or the effort reward imbalance model. Research has shown connections between work psychosocial stress and health. High job strain has been associated with increased risk of carpal tunnel syndrome, where, on the other hand, social support in the workplace was found to be protective. High job strain has also shown associations with increased risk of other health outcomes like cardiovascular mortality and increased total cholesterol and BMI. Specifically in regards to janitors, work psychosocial stressors have been associated with the development of musculoskeletal disorders in cleaning workers and janitors. But the impact of psychosocial stress on the mental health of janitors is not as well documented. Which brings us to the topic for today, which is the California Janitor Workload Study, and some components of it that I'll share with you. As you'll see in a moment, there's a lot more to this study than we will be able to cover today, but this is why we're here, and I'm glad you have interest in this topic. This study is being conducted by the Northern California Center for Occupational Environmental Health, COEH, whose mission is to protect workers and communities from occupational and environmental health hazards through teaching, research, and service. The core faculty on this project are Dr. Carissa Harris. She's the director of COEH and the UC Ergonomics program. Laura Stock, who's the director of the Labor Occupational Health Program, or LOHP, and Dr. Fadi Fatala, who's the director of the Agricultural Safety and Health Program. I'd like to take a moment before we get too far into this to acknowledge the other team of researchers who have put in many hours and on the analysis and will continue to work on this. And these are some names here that you'll want to keep your ears out and your eyes out for, because more will be, you'll hear more from these folks as time goes by about this topic: Max Bloomberg, Javier Freire, and Dominique Pina, and Alan Barr, and myself, Melissa. So this janitor workload study has three big components. The first is a survey. The survey is measuring the impact of COVID-19 on the janitorial industry within California. We're assessing exposures related to the janitorial tasks and the mental and physical health outcomes of the janitors. Followed by the survey will be focus groups. So these are being conducted by LOHP to understand the work changes associated with the pandemic, the productivity requirements and management challenges in the industry. And then finally, a time motion study. A time motion study is something that's underway at the moment. And if we have time at the end of the webinar, I'll share with you a little bit more about that. But our goal with the time motion study is to measure biomechanical exposures and assess risk in 4 different work venues: office buildings, shopping malls, event spaces, and airports. And we will take that data that we have and compare that to actual production rates that are published by ISSA, that are what most janitorial scheduling and workload are developed from now. The overall aims of the survey are to compare California janitor workloads before and during the pandemic and now, and to describe the relationships between workload, work climate, COVID-19 prevention measures, organizational policies, and physical and mental health, and to determine the types of COVID-19 prevention measures implemented at janitorial workplaces. This directed acyclic graph illustrates the different associations that we will analyze and investigate with all of the survey analysis. But we won't get into all of that today. That would be a much longer talk. Today, we're going to focus on job strain, precarious work, physical and mental health. We'll discuss the characteristics of the California janitor population. We'll describe exposures related to precarious work and job strain. We'll explore those and explore some differences by age and sex and union membership and years worked as a janitor. And then we'll assess the associations of job strain and precarious work with physical and mental health outcomes. So just a little bit about the survey. It's a cross-sectional survey that was presented in Spanish and English. It was distributed to union members and non-union members of labor organizations. The survey was sent out by email, text, and through social media blasts. And this was distributed last year in the spring and summer, so spring and summer of 2022. We noticed some real challenges with response rates and survey completion, however. So going forward, we are collecting survey data one-on-one through interviews at the data collection sites where we are conducting the time motion studies. No identifying information was collected other than age, sex, and ethnicity, and anyone was eligible to take this survey as long as they were a California janitor and 18 years or older. There's 75 questions in the survey, and it takes about 45 minutes to complete. So these are all the different topics that are covered in the survey. The 4 that are highlighted or bolded are the 4 that relate to the topics for today, but you can see overall what we asked about. But today, again, we're going to focus on work safety, workplace climate, mental health, and physical health. So the job strain questions that were, on the survey were they came from the job content questionnaire survey. So we used a modified version of the job content questionnaire survey from Caretakers, and the questions are listed here. They were all rated on a 4-point scale from strongly disagree to strongly agree. And we see on the left of the screen the questions related to decision latitude. Decision latitude is otherwise known as job control. You see the questions here that they responded to. On my job, I have very little freedom to decide how I do my work. I have a lot of say about how it happens on my job, or my job allows me to make a lot of decisions on my own. So again, these were rated on a 4-point scale. So the range of the range of total score was 3 to 12. And yes, we had to reverse the scoring on the first question there because that does have a double negative in there. Now, for psychological demands or job demand, another component of job strain, we ask these questions. I do not have enough time to get my job done. My job requires very fast work. My job requires very hard work. My job requires excessive work, and my job involves conflicting demands. Again, 4-point scale with a total range of score of being 5 to 20 for psychological demands. Now, if we had any missing responses for either of those scales, we replaced them. If there was one response missing, we replaced it with the mean of the existing responses. If there were more than two or more missing, we just did not include that response in the analysis. So what we had for our analysis were these exposures for job strain: psychological demand, decision latitude, and job strain ratio, which is a way that you can combine the 2 measures together to have one sort of job strain score, if you will. There's different ways of combining those, and this ratio is the way we chose to go. We took these exposures and dichotomized them into 2 low and high categories so that we would have 2 different groups for our association analyses. We split the groups around the median of the responses, and in our analyses, the low group was considered as the referent group. So now we can talk about exposures for precarious work. They are listed here. We looked at these 6 measures that are sort of conditions of precarious work, if you will: job insecurity, wage theft, underreporting of injuries, working extended hours, physical, sexual, and verbal bullying, and a measure that we created called harassment, which is if any of the different types of bullying were present. These are the questions from the survey that apply to each of these exposures. So for job insecurity, the question was, how easy would it be for you to find a job with another employer with approximately the same income and fringe benefits that you have now? So if you were to get laid off, how hard would it be to find a job? Wage theft: how often have you worked hours that were not paid? For underreporting of injuries, the question was, rate your agreement with this statement about your supervisor. And this statement was, I can report an injury without fear of retaliation. For working extended hours, this was a combination of 2 questions, one that indicated that they worked more than one job, and the other that they worked a total hours per week greater than 40 hours. And so the definition of working extended hours is working two or more jobs with a total of 40 or more hours per week. For physical, sexual, and verbal bullying, the question was worded as this: how often are you concerned about being, and the 3 different types of bullying or harassment. And then again, the harassment exposure is any type of bullying or harassment present. Similarly to the job strain variables, we dichotomized the categories for association analyses. Excuse me. All the precarious work variables were dichotomized to create 2 categories. Instead of a low and high group like we had with job strain, we ended up with a precarious and a not precarious group. So for example, how often have you worked hours that were not paid? That question, the responses to that question were put into a category of either no hours were worked that were not paid, and that would be a not precarious category, and any hours were worked without pay, which would be the precarious category. So that's an example of how we utilize those groups. And the not precarious category was considered as the referent group in our association analyses. As far as outcomes of physical health, we looked at pain and injury. Pain was rated on a 10-point scale, which was averaged across 4 body regions. And we used a pain score of greater than 5 to indicate severe pain prevalence. And as far as injury prevalence goes, that was defined as having 1 or more work-related injury in the past year. For mental health, we used the PHQ-9 and GAD-7 surveys for depression and anxiety. If there was a score of 10 or more on either of those, that indicated depression or anxiety. And if there were missing responses, we replaced those with the mean of the existing responses if up to 2 were missing. But if 3 or more were missing, the response was not included in the analysis. We ended up combining anxiety and depression for the purpose of this talk due to low case counts of anxiety alone. We, in terms of stats, to evaluate the associations, odds ratios and 95% confidence intervals were calculated using logistic regressions and Stata. We did that for both the job strain measures with health outcomes and the precarious work measures with health outcomes. On all of the models were adjusted for age and sex. We investigated the possible confounding of education, more comorbidities, and smoking, but those were determined not to be confounders. So what did we find? Here goes the results. So 715 people responded to the survey, or completed the survey, I should say, with 457 of those responding to questions about job strain or precarious work and at least 1 health outcome. So 457 is the number that we are using here in our demographics reporting. You see that the vast majority of the workers are over age 30, with 48% between age 50 and 65. 43% were between 30 and 49 years old. Mostly female, 74% female, and mostly Hispanic, with 96% Hispanic. The mean number of years that they worked as a janitor was 12.5 years, and you can see the distribution of their total years worked as a janitor here. So this is not the current job, but total years worked overall. 77% were working in office buildings as janitors in office buildings, and with you see the assortment of other work venues there in small percentages, and 66% were members of a union, which could be due to the fact that we utilized unions to help distribute the survey. This simple graph shows the physical and mental health outcomes. So 51% of the sub cohort had severe pain and 27% had an injury, at least 1 injury in the past year, work-related injury. 14% had either depression, anxiety, or depression. So now we'll look at the job strain exposures. What we're looking at here is the mean rating, the mean scores for decision latitude, which remember is like job control and psychological demands, and then that job strain ratio. And we're then also going to present the differences between, within sex, so difference between men and women, union membership, age, under and greater than 50 years old, and the work experience, so working less than 5 years or more than 5 years. And so this format, you'll see this repeated several times, but when we're looking at our other exposures for precarious work as well. But what we found is pretty small differences in the means between the groups, between the sex and union membership, et cetera, those groups, with a slightly higher decision latitude for men and union members, and slightly higher psychological demands for union members. Looking at the associations between job strain and severe pain prevalence, we have that summarized here. And so we see that psychological demands, decision latitude, and job strain, so all of the measures of job strain had positive associations or significant associations with pain, severe pain prevalence. We see positive relationships between the demands, the psychological demands, and the job strain ratio, but we see an odds ratio of less than 1 for decision latitude association, which means that having higher job control actually reduced the prevalence of severe pain, or indicates a bit of a protective effect from job control. In terms of the associations between job strain and injury prevalence, we did not find any significant associations here, but we did see significant associations between the psychological demands and the job strain with anxiety and depression. And so you see 3 times more likely to have anxiety or depression when psychological demands is high, and a similar odds ratio for high job strain. So now we'll look at the results for the precarious work exposures, and we'll start with the job insecurity, or how difficult would it be to replace the job. Over 50% said that they would have difficulty getting another job if they were laid off. That's a lot. If we look at the breakdown between men and women, union and non-union membership, younger and older, and newer in the workforce or have more work experience, we see that there is a higher level of insecurity among men, union members, older workers, and those with less than 5 years of work experience. In terms of wage theft, we found that 23% of workers have worked hours without pay at least 3 times per year. Higher percentages of those were found in non-union members and those with more than 5 years of work experience. In terms of underreporting, this is, again, the question that said that there was a fear of retaliation if you were to report an injury to your supervisor. This one's a little tricky it's got a double negative in there. So the disagree response actually indicates a precarity, meaning I don't agree that I don't have fear. But what I've interpreted for you is that 33% do fear retaliation for reporting an injury to their supervisor. There were higher levels of this fear among women, non-union members, younger workers, and workers with less than 5 years of work experience. Those that were working extended hours, meaning more than 2 jobs and more than 40 hours per week, there were 22% of the subcohort fall into that category. This was true also for more men than women, more workers that are not in a union, and for younger workers. Now we'll talk about the 3 types of harassment that were measured. 27% are concerned with physical harassment at work, which was fairly consistent across sex, union representation, age, and years of work experience, but it did appear to be more of a concern for women, older workers, and union members. So that's physical harassment. And in terms of sexual harassment, 14% overall are concerned with sexual harassment, which was more of a concern for women, non-union, and those with more years worked as a janitor. And then finally, verbal harassment, 33% are concerned with verbal harassment at work. This was a higher concern for men and union members. So when we combine all 3 of those together and look at just total harassment, we see that if they're concerned by any type of harassment or bullying, We found that 37% of janitors are concerned with being bullied or harassed while at work. Did appear to be a higher concern by men and union members. If we now look at the associations between precarious work, the different measures of precarious work and prevalence of pain, we found significant associations with job insecurity, wage theft, and harassment as associated with severe pain prevalence. In terms of associations with injury prevalence, we found a positive association with harassment. So those that are concerned about harassment are more likely to have had an injury in the past year. Harassment was also a positive association with anxiety and depression, as was wage theft. So those that had worked hours without pay had a 2.8% higher rate of having anxiety or depression. So that was a lot of numbers, and I want to just summarize things to sort of bring it back together for us. In terms of job strain, we found small differences in the means of job strain measures between groups. The trends, though, indicated higher psychological demands for union members than for non-union members, which may indicate that those that feel that their job is more demanding may be more likely to organize. That could be one explanation. Higher decision latitude was found for men more than women, and for union members more than non-union members, meaning that these groups felt they had more control over their job. And perhaps this is related to traditionally that these groups may feel more empowered in general, so they may feel like they have more control. Exposure response relationships were found for job strain and the negative physical and mental health outcomes that we measured. We found high psychological demands were associated with increased prevalence of both severe pain and anxiety or depression. So the work that was more demanding, or those that perceived their work to be demanding, had a higher prevalence of severe pain and mental health issues like anxiety or depression. Job strain ratio was also associated with increased odds of anxiety or depression. And high decision latitude, however, led to a lower prevalence of severe pain, which makes us, leads us to understand that job control had a protective effect on the prevalence of pain. So how can we apply this in practice? This is as a practitioner myself, and have spent many years working with people in different industries. This is always the big piece that's interesting to me, is how can we take what we are finding in research and apply it to practice? And there's so much to work with these findings. There's a lot of really useful information that we can work to apply, and how we go about that is the next challenge. We definitely need to work on designing janitorial jobs that are demanding in nature with higher levels of worker control to improve health outcomes. So this idea that job control is protective is something we can take and run with. And how can we give workers more control? And the first thing I think about is utilizing a participatory approach in a janitorial, in a company, within a group, within a company, within utilizing the unions that are already in existence to and how can we ask the workers how, and talk about work control and come up with ideas so that we can define specific methods that don't interfere with getting the work done, the demands of the job, but really help to enhance and optimize the worker control piece, which is not only protective on its own, as we saw with the results, but also when combined with the job demands, that job strain ratio, trying to drive that job strain ratio down so those job strain scores are lower. I think really the place we have the most opportunity to affect change would be with the worker control, because the job itself is going to be a demanding job. It's sort of the nature of the work, but we can control we can make some changes to the control side of it. In terms of the precarious work findings, I just want to summarize these here because these numbers are a little staggering. We, as a team, when we were reviewing this, it was just very eye-opening. 51% feel insecure in their ability to find another job if they're laid off. 37% are concerned with being harassed at work. A third of janitors may underreport injuries for fear of retaliation. Just under a quarter experience wage theft and work more than a full-time job schedule. Job insecurity and precarious work conditions may lead to tolerating harassment and work-related pain for fear of losing one's job or not being able to get another job. We did find exposure response relationships for the precarious work measures and negative health outcomes. Those that worked hours without pay, meaning they experienced what we call wage theft, and those that felt it would be difficult to get another job if they were laid off, meaning those with job insecurity, were more likely to have severe pain. And wage theft was also associated with a higher prevalence of anxiety or depression. So we're seeing that financial insecurity, whether it's from not getting another job that your money comes from, or just not getting the money that you are due from working those hours, having that financial insecurity affects the mental and physical health of janitors. We also found this relationship between bullying and health outcomes. Those concerned with any type of bullying or harassment, physical, sexual, or verbal, had significantly higher odds of severe pain prevalence and anxiety and depression. So workplace harassment affects physical and mental health and is something we need to work on. So what can we do? How can we apply these findings to practice? We need to work to improve job security and eliminate wage theft. The industry needs to provide protected work arrangements with reliable payment systems. And so that may mean full-time work. It may mean other arrangements that have protections and that have reliable payment systems in place. But this is what we're seeing could really, make some big benefits and make some big changes for the health outcomes for janitors. And we need to reduce harassment in the workplace for janitors. And also sort of related to that is improving the supervisor and employee relations, which can help promote early reporting. So I say kind of related to that, not that they are one and the same, because janitors may be getting harassed by not necessarily their coworkers or anyone within their company, but by the clientele or the customers or the people in the workspaces that they are cleaning. And so, but I think that there is an opportunity for increasing early reporting and improving supervisor-employee relationships and just not tolerating harassment by working with the teams. Again, this idea of participatory approach to listen and to hear and to respond to what janitors have to say, to help develop trust and increase awareness about the importance of early reporting and the intolerance of harassment in the workplace. So I think that the way that we can, the things that we can do to apply these findings in practice are related to what we can do with the job strain piece, in that it's empowering workers, it's providing some control, whether that's of how the tasks get done or how the individuals tolerate the treatment of themselves in their work. So there is a lot more to come in this space, in this study, just some things that you can keep your eyes open for in the coming months. We're analyzing differences in job strain associations by the sex, age, union membership, by venue worked, and by years worked as a janitor. So we're going to dig into those associations a little deeper. We'll look at relationships and interactions between job strain and precarious work conditions, because there may be a connection there. And the vulnerability of work. If this precarity of work piece is interesting to you, stay tuned to Javier Freire's work. He is taking the precarious work, data and taking it to another level of analysis with a vulnerability measure that he's developing. So that the effect of vulnerability on physical and mental health is something that you will see from him coming soon. Max Bloomberg and Dominique Pina have both been working in the relationship between janitorial workload and negative health outcomes, and the differences between men and women and different age groups. And so we didn't talk much about workload at all in this webinar, but that is a big piece of this study, as the title says. And so you can look out for some of that work coming soon. I have a few more minutes here. I think I will take those minutes to introduce a little bit more about the time motion study. So we've just talked about the survey. The survey is a huge piece of this project, and the focus groups as well. But the time motion study is another very big piece that's a very hands-on piece, and it's currently underway. And I think it's worth sharing with you a little bit of information about that. So the time motion study is a real collaborative project with the key stakeholders that you see on the left here. The employees, obviously, but we're working, it's union driven and company, employer supported, and the building owners are another key stakeholder. And these groups are all working together to get us, to help us measure the data that we need to be able to do our analysis. So it's been a very collaborative project. We are quantifying biomechanical exposures so we can assess the risk of injury associated with janitorial work. So we can compare that data that we gather to the actual compare the actual rates to the production rates that are currently being utilized. They're called the ISSA 612. The International Sanitary Supply Association has published production rates for janitorial work, and that those rates are most usually what employers use to schedule janitorial work. And so we will compare the actual measurements to those production rates, so we can determine if there's recommendations that can be made to reorganize work, so to make safer work that's more impactful for preventing injuries. So this will be something that is you will hear about this. It is to come. We are currently measuring do time motion study measurements in airports, in shopping malls, in office buildings, and in event centers like big convention centers. These are just some images of what what it looks like when we're doing our time motion data collection. We're using video cameras and measurement tools to measure weights and distances and reaches and push-pull and grip forces. Some participants will wear the XN suit of IMUs, so we can have very accurate kinematic data. And we'll be taking the video data and doing detailed video analysis with MBTA. If you're familiar with MBTA, this slide makes sense. If you're not, I'll just break it down a little bit for you. Basically, with this software, we can take frame by frame video to identify or tag what's happening in each frame. So for instance, what workspace is the person in? In this case, he's in a bathroom. What task are they doing? In this case, this would be, paper towel. And what tools are they using if there are tools being used? And so we can then generate reports that give us very accurate summaries of time on task. So how long was, did different tasks take? How long were different tools used, et cetera, so that we can then use that for those comparisons that I mentioned. So with that, I just want to thank all of the individuals that have participated, all of the California janitors that have participated in this study, and also the SEIU union and the MCTF organization for their support of their members and this industry in general. And you have my email address there. Feel free to email me questions later. But Alan, I believe we have time for questions now.
Thanks, Melissa. That was fantastic. Yes, if you currently don't have any questions, if you have a question you would like to address to Melissa, please enter it into the online Q&A now. I guess I took a couple of notes down here, just curious. So this was all done during COVID, or sort of post the onset of COVID. Do you think that the results would be any different, better or worse, had these surveys and everything been sort of administered before the advent of COVID-19?
Well, I mean, they definitely be different, I imagine. It's a good question though, because the timing of the whole project really makes a difference. We started this project in 2021, started planning this project in 2021, and it was really, like I mentioned, it's union driven because of the high rates of injuries in the janitorial industry. But if we all think back and remember at the beginning of COVID in that first year, that there was so much additional disinfection of surfaces that were being required. And so there was a concern or belief that the workload had really increased due to those additional job requirements. And so that was a big driver for the study in the first place. And so it is interesting though, that, what's happened as we take time to get through these different steps of the research process. And when we first asked these questions, that, the results that I shared with you today, we were at a point in the pandemic where, most, things were starting to open back up. You're still to wear a mask on an airplane, but you didn't have to wear a mask in public spaces in California. And so things were starting to open, but and overall, workload may have been slightly lower just because of the capacity of the buildings, but we don't know for sure because there may have been lower numbers of staff on hand at those times. And so we've talked a lot about, what does the impact of that have on these numbers? And the numbers are what they are. And, we're continuing to get more data now when things are pretty much back to quote normal. I mean, we've waited this long to go into office buildings because there were no workers in them. And so we're finally now going into office buildings. And when we go into these work sites to do the time motion study, we're also deploying the survey so that we can get a higher response rate in these venues, so that we can determine if the data that we gathered in the Big Blast survey of last year is representative, compared to what we're seeing in these more controlled populations. So it's a great part of the puzzle, and I think it would have been really great to have all this data from before, but that's how it goes.
Sure. A questioner asks, perhaps prompted by this image on the screen, was there any data collected on chemical exposures?
Yeah, that's a great question. pardon me, yes, there is some component that's chemical related. I don't have any of that information, but there will be when we get to the end of this project and the reporting out, there will be some less exposure measurement and monitoring, and more just what chemicals were used and getting into that a little bit. So that's all that's the best answer I have for you there. But yes, that was a component.
Thanks. Do you think there's anything particular to California janitors that would suggest that these data don't apply equally as well nationwide? I realize that's highly speculative, but
Yeah,
I'm just wondering
mean,
if there's anything that jumps out at you.
I don't know anything for certain that I can say, but the thought that occurs to me is, is kind of related to the timing of I don't know. I don't know that this is really adding any value, but I'm thinking about, the mask restrictions and the mask laws, that mandates that we had in California at the times of these, gathering of this data were different than in other parts of the country. And so that could play into it, just in terms of general stress and anxiety. So that's my best shot at that one. I'm not quite sure.
Got you. These are, we don't have questions pending. If you have a question, I see someone has raised their hand. If you wouldn't mind typing that question into the Q&A box, or just let me know that you absolutely do not want to do that, and then I will find another way to field your question. I was curious if there was a breakdown of the survey data along the lines of venue. It struck me that some venues might be just more stressful than others, whether or not a janitor was required to work, especially sort of having seen it in an airport setting, an active airport terminal, which that energy and that natural overbearing stress versus a closed early morning shift, perhaps of an office space. Those two may more contemplative type space. But is there any plan on breaking the survey down on those lines?
Absolutely. So that is on the list of analyses that we will get to. At this point, though, if you recall the pie chart of the venues, we just don't have a lot of data in the current data set that we shared in those other venues. But that's why we're looking forward to, really getting a good response rate from the 4 venue types that we're working in. And again, office buildings, airports, shopping malls, and event centers. And so if we can get a higher percentage response rate in those areas, we can really make those comparisons more robustly. It is, you make a great point. I mean, we've been in airports, I've been in shopping malls, and the day work is much different than the night work. And a lot of it has to do with the people around you, right? The customers or the clients in the buildings, and the ability to work around them or not, not have to work around them. And so I think that we will also be curious about not just the task comparisons, comparing bathroom cleaning to floor cleaning to dusting to windows, but also looking at, I think, day and night shift, because I do just seeing what I've seen, anecdotally, I think that there's some differences there, and that's important information for scheduling, right? So if the hard work is all done on the night shift, that's, we can't have, it's just imbalanced that way. If everyone's doing, the night shift folks get stuck with all the really hard work. So it's good. It'll be good for us to look into that.
Thanks. Somebody commented that they appreciate the webinar during May Mental Health Awareness Month. So I think that's a timely comment. And I'll just put out there, I hope we didn't trigger any anxiety with that MBTA slide. Anybody that's used that software has
if you know,
has paid their dues. That's
yeah.
Right. So another questioner asks, have you done any similar studies in the healthcare worker cohort? And I I know we have presented some of those, I think, in webinars in the past. You could go to YouTube and take a look through our archives. You may find something that addresses that. Nothing jumping to mind right now. Melissa, do you know of any?
No, so same answer. I don't know of anything specific, but that webinar archive is
Yeah,
chock full
it's
of
pretty
great
rich. I
stuff.
would jump in there and take a look around.
Yeah.
Last comment here, someone says a similar study was done in Washington State prior to the pandemic. Their experience may lend to the understanding of what it was like before the pandemic. That's an excellent comment.
Yes.
And I
Yeah.
think we probably have some of that Washington State data in our archives as well. I'm not plugging this overtly. I'm just telling you that it's a pretty rich database. You might want to jump in there and take a look. Melissa, thank you so much for an excellent presentation. There was a lot there. That was must have been challenging to sort of wrangle all that together. That was an excellent presentation.
Great. Thanks, Alan. Thanks, everybody.
So at closing remarks, you can learn more and register for upcoming events at coeh.berkeley.edu. You can also subscribe to our YouTube channel, as I mentioned earlier, where you'll find recordings of previous webinars and other events. You will, if you're logged in with your registration email, you will receive a link to an evaluation form. And that form will qualify you for a certificate of completion worth 1 continuing education contact hour. If you have any questions for us here at COEH Northern California, you can drop us a line at coehce@berkeley.edu. That's coehce@berkeley.edu. We'd love to hear from you, and we can always answer your questions or do our best. Thank you again to Melissa for taking the time. And yeah, we will see you at the next one. Thanks, everybody. Appreciate you. Bye, Melissa.
Bye. Thank you.